Let's look at the position statement from 2023 for the Menopause Society about non-hormonal treatment for the symptoms of the menopause transition. And I've got to show you some things, and there are some issues I have, and I want you to understand it. This is from the Menopause Society, which is in the US, the group that speaks on behalf of research for menopause. But I want to remind you that funding has to occur for research to have power. You see, the study design, there has to be enough people to show that we can apply it to the masses. And where is the funding? You see, who is going to fund studies on women in perimenopause, women in perimenopause and the menopause transition who aren't taking medications? Are there enough grants for that? No, there's not. So when you look at this position statement and look at the articles, I want to show you something. So here's what the paper looks like. You can go find it at menopause.org, the 2023 non-hormone therapy position statement of the North American Menopause Society, which is now called the Menopause Society. And when you look really closely at this, what this paper really is about is controlling vasomotor symptoms. We do now realize that perimenopause and the menopause transition has over 100 symptoms. So this statement seems like it's kind of all-encompassing on menopause symptoms. That's what you think at first glance. But really, they're talking about vasomotor. Why do they talk about vasomotor? Well, it's kind of the quintessential symptom of menopause. And it's like the one thing that they can be like, aha, it's menopause. That's why you have vasomotor. So that's why they test it. Now, of course, hot flashes aren't just bothersome. They are very, very real, and they are a tell for cardiovascular symptoms. And so, yes, we do care about vasomotor symptoms, but we also care about all the other symptoms. And sometimes some of these treatments that are shown to not be recommended are recommended for other things that aren't vasomotor symptoms. Let me show you an example. And I say this all because we know and believe that hormones are the gold standard for controlling vasomotor symptoms, but there are many other symptoms of the menopause transition that we need coping skills and tools in our toolbox to help us cope. And that is true. Not all people can do hormones because of breast cancer or cardiovascular disease. And we do need women to have options. So when you read a statement like, here is the segment of that paper speaking to exercise and yoga. And let me read this to you. Observational studies reveal that women who exercise regularly report fewer vasomotor symptoms. However, others have found no relationship between the level of physical activity or exercise and vasomotor symptoms, and exercise may trigger vasomotor symptoms in symptomatic women, meaning late perimenopause, early postmenopause, when they are the most volatile. Several Cochrane reviews concluded that there was insufficient or poor evidence to consider exercise as a treatment for vasomotor symptoms. Do you know there's nobody going to fund this? Because if it's not pharmacological, who's going to give money to exercise for women? Really, like seriously, this is how we don't have enough evidence, but I continue on. Among the challenges, methods and exercise interventions varied widely across the studies, which makes it very difficult. They included, for example, supervised walking versus yoga versus no intervention, and supervised aerobic exercise versus yoga versus usual activities, plus omega-3 or placebo pills. No difference was found between yoga and exercise. When studies revealed exercise versus no exercise, when they looked at this, exercise had no effect on vasomotor symptom frequency. One study in the Cochrane Review comparing exercise and high-intensity exercise, hormone therapy, found that hormone therapy was far more effective than exercise in reducing vasomotor symptoms. Yes, hormone therapy is the gold standard of care for vasomotor symptoms. There is no surprise there. No one would claim that exercise surpasses estrogen for treating vasomotor symptoms. There's none of that. So yes, that's going to be the gold standard, but it doesn't mean that exercise and yoga should be thrown out because it doesn't reduce the frequency of vasomotor. There are many other symptoms such as widespread joint pain, fatigue, sadness. You get my drift. Let's carry on. A pooled analysis of individual data from 4 MRS flash trials assessed various interventions compared with placebo for vasomotor symptoms, including hormones such as estradiol, antidepressants, omega-3s, cognitive behavioral therapy for insomnia, yoga, or aerobic exercise. Women with the most bothersome vasomotor symptoms benefited from estradiol. Okay, we know this. We're not doubting that. We're so thankful for it. Whereas those with vasomotor symptoms and insomnia improved with cognitive behavioral therapy for insomnia. Those with vasomotor symptoms and psychosocial complaints reported improvement with antidepressants or cognitive behavioral therapy for insomnia. Overall, exercise and yoga led to smaller improvements and were not recommended for single interventions for vasomotor symptoms. A systematic review and meta-analysis of 12 randomized controlled trials assessed yoga against no treatment, health education, exercise, and ear acupressure for the treatment of vasomotor symptoms. And given that the outcomes were all self-reported, there was insufficient blinding, and basically the design was bad. So they found nothing. So they don't recommend paced respirations. They don't recommend supplements. They don't recommend soy food. They don't recommend avoiding triggers. They don't recommend exercise, yoga. Like if you just took this at first pass, you'd be like, well, that's it. Nothing works but drugs. But that's not exactly it. They all have different purposes and they serve different things, but the funding is so bad. And we don't have enough people talking about the menopause transition. We don't have enough to study designs even happening. So if you guys see a research study for perimenopause and menopause, volunteer, please participate. For instance, you matter to this research study so the future generations can have more evidence showing more options for non-hormonal treatment for other symptoms of perimenopause. And me, as a physical therapist, I have a bias towards exercise. I have a bias towards education because that is what I give to my women is exercise, breathing, and changes in behavior because that's what I bring to the table. So yes, I am a little biased that I do love exercise and I am about to run a study on the effects of yoga for women in the menopause transition. And I want to see and measure a lot of different things and see what yoga is going to help these women with. I suspect that the mind-body practice of a woman doing yoga for the first time will help them cope with the symptoms of menopause, will help them feel better with their joints and improve flexibility. And I dare say, if I work on the regulation of their sympathetic and parasympathetic through breathing and that mind-body connection, couldn't I possibly make a change in heart rate variability, which heart rate variability and muscle mass are the two greatest predictors of longevity in women. So during this menopause transition, I would love to have the tools and resources to say, you know what? This is the time you start doing yoga because I want you to maintain your flexibility. I want you to learn how to breathe. I want you to learn how to regulate your nervous system. I want you to learn how to weather this storm and keep your joints supple because you're going to be a changing person. I would love to have a study to show that women in the US could use yoga to help them cope with the symptoms of perimenopause.